tool calculates your individual risk when having surgery and identifies top-performing hospitals for your particular procedure. Here to explain how this tool helps you make an informed decision about where to get your care is Dr. Arkel Giorgio. Good morning, doctor.
Good morning.
This is so interesting. Tell us how this new online tool works.
The HealthGrades Risk IQ tool lets you calculate what your level of risk is for 6 common surgical procedures. And here's why that's so important. Every surgical procedure has some level of risk. Sometimes the risk is easy to address complication. Other times that risk can be as serious as death. And it's important for an individual to know what their personal risk is. So by putting in some simple information, your sex, your age, some information about your past medical history, as well as where you live, the tool automatically calculates whether you're low, average, or high risk. And then the next step is that it also tells you where the closest 5-star hospitals are. 5-star meaning highest quality, lowest complication rate, lowest mortality rate is, that are closest to you.
This is so interesting. So once you identify your individual risk, it helps inform you on where the best place might be for you to have surgery.
That's right. And you know, the reason that that's so important is there's multiple factors that go into whether or not you're low, average, or high risk. But most of those risk factors we can't control. Can't control our age, unfortunately, sex. You know, there's not a lot that we can do about our past medical history, but you can control where you have your surgery. And it makes a difference because the quality of all hospitals is not equal. For example, if somebody needed to have a hysterectomy, if they go to a 5-star hospital, their risk of a complication is 60% lower than if they didn't go to a 5-star hospital. So where you go matters.
I love it. You're really helping people be informed. Could you give an example of how it might help somebody here in Las Vegas choose the right place to have a procedure done?
Sure. Well, let's go back to that hysterectomy example. In the Las Vegas area, you know, hysterectomies are done at virtually every hospital. So only very few people would have to drive greater than 5 miles to get to any hospital performing a hysterectomy. But 72% of people would have to drive more than 5 miles to get to a 5-star hospital for hysterectomy. Hospitals like Sunrise Hospital or Valley Hospital. And so the statistics are very similar for procedures like total hip replacement, total knee replacement, coronary artery bypass surgery, bariatric surgery. The point being that the best hospital may not be the one that is closest to you. So if you know your individual risk, you can make an informed decision about whether or not you're going to stay close and take your risk, or if you're going to drive a little bit farther and go to a hospital that's going to give you a better chance for a good outcome.
I got you. I really appreciate this. I think you're empowering people to participate in their own care and have some control over the quality of their care. How can people take advantage of this new tool?
All of this information is on healthgrades.com, and the HealthGrades Risk IQ tool is right on the homepage.
Excellent, thank you. And tell me what examples you have seen where this has assisted people in connecting with top doctors and hospitals for their procedure.
I'll give you a very personal example. My own
Please.
mother-in-law was having open heart surgery, and she had a great doctor, a great surgeon, who recommended that we go to the closest hospital to our home. She was staying with us at the time, but we chose to have her go, we use the same surgeon, but go to a slightly farther away hospital to get her surgery because it had better statistics. So we were really happy that we made that decision.
Yes, this is great. This is just such a great use of technology, isn't it?
Well, it is, and I think it's important that people really have a voice in their health care and know that they have choices.
Doctor, thank you so much. It's been very interesting to find out about this.
Thank you so much.
Yes, to find out more about HealthGrades and what it can do for you, call the number or head to the website on your screen.